Respiratory therapists are my partners in taking care of these people. Everything from pulmonary function testing so that we can make diagnoses of respiratory illnesses, severity of respiratory illnesses, to assisting with non-invasive ventilation, mechanical ventilation, to inhaler training. I mean, they're really, I really partner with them to provide the best respiratory care for my patients possible.
Respiratory therapists are across every part of the hospital. There's not an area within the hospital that they don't go. So they see all sorts of different patients, all sorts of different providers. They get to work with a lot of different people. And I think it's a fun thing to have variety in your day, to not know what your day is going to be all the time, and to just have such an impact across such a variety of patients.
In an ICU, it's managing very sick patients on ventilators and making sure that they're receiving adequate support from the ventilator. On a general ward, that may be treating someone with an exacerbation of underlying COPD and making sure they get the appropriate medications, and actually, at times, even educating physicians about what the appropriate medications are for some of those patients. In the outpatient setting, it may be teaching patients how to use medications, maybe performing pulmonary function studies, or even working at a home care company, going into the home and instructing patients on how to use things like nebulizers, or how to use their oxygen equipment, or even their CPAP or BiPAP devices.
We have a lot of teamwork. We're really supportive of each other across the system, not just at Corning. Across the whole entire system, we work together. It's a great place to learn. It's a great place to grow. There's plenty of opportunities for any sort of RT to get all sorts of experience. So I think it's a great place to work, to grow and to get better at your trade, and we love all our ITs.
Guthrie leadership is committed to supporting and recruiting the best talent in respiratory therapy. They know the value of the providers that we have, the skill level that the therapists have that they bring to the patients every day, and they are working regularly with leadership, myself included, and others around our system, to ensure that we are not only able to recruit the best talent out there, but also to retain the incredibly valuable, skilled people that we have right now.
I would say it's true teamwork dynamics. We work as an equal together to take care of our patients. Whenever I need help with anything, Sam has my back, and vice versa. If she needs anything, I'm right there for her. So we really work together. Some patients come in and they'd say, wow, you're a really well-oiled machine in here.
What moment during the COVID-19 pandemic weren't they necessary? Everything from high flow oxygen therapy to non-invasive ventilation to invasive ventilation, they were my right arm during the COVID pandemic when things were so hard in the ICU and out on the floors.
The respiratory therapy team is integral to care for people with respiratory illnesses, and also anyone, perhaps due to an accident or an emergency, who has a critical injury to the respiratory system. They're vital for best care for people in any situation because of their expertise. They are basically the masters of breathing, if you will.
Respiratory therapy is a really important modality. They are a critical part of caring for every patient. They see every kind of patient. Whenever somebody is having difficulty breathing, you want a respiratory therapist there. They have the specialized knowledge, the expertise, to be able to know what to do in every situation, critical patients, all the way to infants and elderly. So they're really a critical part of the team.
I'm from Mansfield area. I grew up with an uncle who had cystic fibrosis, so growing up I was always part of raising money for the foundation and educating people on what the disease process is, and I always heard lots of stories about how respiratory therapists helped my uncle, so it was a passion of mine and it really influenced me to get into the field. I decided to go with the program because I've heard of the reputation that it has and how it prepares you for the career itself. And it's a very competitive program, and it's also nice that it's a bachelor's degree because it opens more windows in the future. I received a scholarship from Guthrie, and it was an interview process that I had with two of the managers that are currently working for Guthrie, and it was a two-step interview process, and after the interviews they accepted me into their program. I signed a contract, and now they're helping pay for my education.
Our company culture is a benefit of being in a rural healthcare environment. It really is family-like, a very family-like supportive work culture, really rooted in our core values of patient-centeredness, teamwork, and excellence, where we provide top-notch, excellent, high-quality, innovative care within a multidisciplinary group of caregivers focused on one thing, and that's the care for the patient, focused all back to the patient-centeredness.
Experts. As a nurse, I have this saying I love is doctors save lives, nurses save doctors. I'd like to rephrase that in nurses save lives, but respiratory therapists save nurses. If I have a patient with respiratory issues, I'm usually not calling my co-RN, I'm calling my respiratory therapist. They're either problem solving over the phone, or before I blink, they're at my bedside to help me provide the care needed for the patient.
Compassionate comes to mind because when I spend time rounding and talking with the staff, especially after there's been an incident in which they've been in a life-saving situation, I see, I hear, and I feel just how much they care about the patients. And it's yes, they're applying their skills and their abilities, but they're also recognizing that they're with a human being and that they're working so hard with the rest of the team to keep that person with us and restore their health.
These people put in, hours of labor that's sometimes not appreciated or seen, but it's so important for pulmonary care of our patients here at Guthrie.
Respiratory therapists are a cornerstone of a group of people who take care of very sick individuals in ICUs, who take care of people with very severe pulmonary disease in both an inpatient and outpatient setting. So from a pulmonologist standpoint, respiratory therapists are our partners and are very essential to our ability to take care of these patients. And the COVID-19 pandemic only served to magnify the importance of respiratory therapists in the U.S.
Every patient, every time, keeping the patients first. They're the center of everything that we do. It's important to get these patients well, to get them feeling better, and the respiratory therapists really have a key role in that.
Improving lives. Our respiratory therapists play a critical role in our emergency and critical care settings. And a huge thank you to all of our respiratory therapists.
Being able to help educate patients in their own disease process and help them learn how to manage their process easier and getting out of the hospital and feeling better.
Their skills, they can be anywhere from A to Z. 1 minute Sam could be holding a hand in a patient, helping them breathe during a breathing treatment, to jumping in and saving lives in a critical care situation. Without respiratory therapists, us nurses cannot fully function. We need to have them at our bedside, and we so appreciate them.
The way our team handles emergencies In the hospital, emergencies are typically announced overhead when it comes to someone who is in need of a life-saving intervention. And when I hear that, I know that those people are in the best hands possible when they're being seen by our respiratory therapists.
I am very proud to be able to be a part of the weaning ventilator program here at Troy Community Hospital. We are able to see those patients get back out into the community and give them their quality of life back.